Now that you kind of have a basic understanding of how to schedule a new patient and also an existing patient for their appointments, I'm going to show you how to actually schedule an existing patient for their continuing care appointment. A continuing care appointment is also known as a recall, and these are the appointments that we set up for our existing patients that are due for their periodic cleaning and checkup. They occur every 6 months, and at the time of the appointment, we complete an exam, we do x-rays, and a prophylaxis, which is also known as a cleaning. So let's get started. As you can see, I am on our appointment book view. If we double click anywhere that is an open time on our appointment book view, we will pull up our patient search criteria box. So I'm going to double click here, and it opens up the search box. As you can see, under this open search box, we can choose to search by the patient's last name, first name, date of birth, their chart number, and many others. I typically like to search for a patient using their date of birth. So let's say this patient's mother has called in to schedule her son for an appointment. We would ask what the patient's date of birth is. So let's say his date of birth is January 1st, 2010. I'm going to enter that in and then hit the double arrows. This is going to pull up all patients of record that have this date of birth. So at that time, you would ask what the patient's first and last name is. So let's say this patient's Joey Dirt. You can either double click on his name or you can come down and hit OK. Once you do that, it's going to create the appointment for you. After the appointment has been created, you want to open up the patient's family file. So we're going to come up to patient info, and once we select that, it'll open up the family file. This is where we can see all of the patient demographics, such as their address, their phone number, insurance information, as well as their family members on the family file with them. On the family file, we want to identify what insurance the patient has and ask the patient if their insurance information is still active. So what that would sound like is, I see that Joey has Medicaid on file. Is that still accurate? And she'll either say, yes, he still has Medicaid, or no, our insurance actually changed. And then you would collect the new insurance information. So let's say that they're still on Medicaid. The next thing we're going to do is open up the ledger. You can come up here to the icon tabs, and if you hover your mouse over the icons, it'll show you what they are. So this little tooth is the patient chart, and this notebook with the pencil is the ledger. So we're going to hit ledger, and the things that we're going to look for in here is who the patient last saw. So which doctor they were seen with last, in what location, and if they have a past due balance. So to see who the patient last saw, we're going to come over up to provider and look down. I can see that the provider that Joey last saw was Dr. Cannon. Now I'm going to come over to clinic, and I can see that Joey was last seen in South Salt Lake. So now that I know that information, I can use that to kind of personalize the conversation with them on. So what that would sound like is, I see Joey saw Dr. Cannon last time in our South Salt Lake location. Would you like to be scheduled with Dr. Cannon again? And sometimes patients are really specific and they're like, yeah, I only want to see Dr. Cannon. Or some are really flexible and they don't mind. They just need a very specific time they need to be seen. So let's say that Joey's mom says she prefers to be in our South Salt Lake location, but she's flexible on the doctor. Now, we want to check for the past due balance. So we're going to come down to the bottom of the ledger, and we're going to look under the guarantor of total balance. That's going to show us if they have a past due balance. So as you can see over here to the right, it shows $0. So they have $0 as a past due balance. This is not to be mistaken with the patient balance. The patient balance currently shows $101.46 for Joey. The reason being is because we have a pending insurance claim on file from Joey's last appointment. So this balance is not Joey's balance. So we verified now that he has a $0 balance, so we can start with the scheduling. So I'm going to minimize the ledger and check to see when his continuing care is due. This is super important to look for. The reason being is if we schedule a patient before their continuing care appointment is due, the insurance will most likely not cover it. So on the family file under continuing care, I can see here that Joey is due on June 21st, 2017. So we are going to make sure to schedule his appointment either on the 21st or after. So we're going to come back to the appointment now, and we're going to create the appointment description and reason. Because it is a hygiene appointment, we get to use a multi-code. These are super nice because they have all of the procedure codes in one, which means you don't have to go through and manually add the exam procedure code, x-ray procedure code, or prophy procedure code. So to access the multi-codes, you're going to come to miscellaneous. Once you select miscellaneous, you're going to come down to the procedure codes list, and it's the very last one, multi-codes. This is going to pull up on the right side all of the different multi-codes that you can select. The multi-codes are specific to what insurance the patient has, how old they are, and whether they're a new patient or existing patient. So let's open up Joey's family file again. Oops. We can see that Joey is 7 years old, and he has traditional Medicaid as his insurance. So we're going to want to select the multi-code that has the M as the insurance abbreviation and is for a child 11 years and younger and as a continuing care appointment. So we're going to come down, and I can see that this one has an M, says CC for continuing care, and is for a child 11 years and younger. Let's say Joey wasn't an existing patient. If he was not an existing patient, we would come up to the one above the one we have selected and select this one. This one shows that it's a traditional Medicaid new patient child, 11 years and younger. As you can see, as we scroll down, they change per insurance abbreviation. So the next group is for Premier Access Medicaid, and the next group is for Delta Dental Medicaid, and so on. So I'm going to come back up and select the correct one for Joey, and hit OK. As you can see, this auto-populates the reason for the appointment and the description. So the only thing we need to add to the description is either Joey's age or a consult that he is in need of. So if Joey is 8 years or older, we're going to add in the description ortho consult. If he is 15 or older, we're going to add ortho/oral surgery consult. If he is under 8 years old, we're just going to put his age in the description. So let's go back to his family file. And as you can see, he is 7. So that means we're going to put the age in the description. So I'm going to space and put parentheses, 7, and parentheses. Now, we're ready to schedule the appointment. The best thing to do from here is hit Pinboard. What that's going to do is put the appointment on your Pinboard on the right side of your screen. This allows you to be able to view any available open appointment times on your schedule and move from day to day using the calendar. So, Joey's prophy is due on or after June 21st. So as we can see on our calendar, the 21st is on a Wednesday. Let's say that Joey's mom has requested to come in on a Thursday evening. So we're going to select the first Thursday after the 21st and hit OK. Now, because Joey is a child, He is going to be scheduled in Op 4 under the hygiene chair. We want to make sure to schedule him next to another appointment in this chair. That allows us to avoid creating huge gaps in between appointments so that this assistant doesn't have to come in for one patient and then wait 4 hours or however long until they see their next patient. So we're going to tell Joey's mother that we have a 3 p.m. available and a 5 p.m. So let's say that she chose the 5 p.m. appointment. We're going to come back to our pinboard and we're going to select that appointment and drag it into that 5 p.m. spot in Op 4. So I'm going to let go now, and it asks if we would like to schedule the appointment. Yes. And we're going to hit yes again, and now we have scheduled that appointment. So you have now successfully scheduled an existing continuing care appointment. Great job!